Room rent, it stays like this 1.25% and 2.5%, but the, while it was 2 lakhs sum insured earlier, so it was 2,500 rupees per day. So this goes up to 4.75 thousand rupees per day, which is a big change, and it will help all of us in terms of making claims and possibly getting most benefit out of it. And in case of ICU, it becomes 2.5%, so it becomes 7,500 rupees for 3 lakhs sum insured and 12,500 rupees for 5 lakhs sum insured, which is a massive change and increase and upgrade over and above what we had last year. Pre and post hospitalization remains 30 and 60 days. I'm sure most of you know it, but just to explain to for the benefit of everybody else. Once you get hospitalized, it doesn't happen suddenly most of the times, but before that also you go for consultations, consult with the doctors, go for tests and something like that, and then that may lead to hospitalization. So these are the expenses or the events that occur before hospitalization. And then suppose you were discharged, then discharge summary comes with a lot of medications, consultations, tests prescribed by the doctors, which can go on for a time. So all of these expenses before and after are covered in the policy through this pre and post hospitalization. But please remember, all those treatments that you have taken or you will take after the discharge have to be in line with the hospitalization, and that is where all things will get covered, and the periods are 30 and 60 days respectively for pre and post hospitalization, meaning before hospitalization 30 days you can go back and see which are things that you have spent on and you can make those claims. And similarly, after hospitalization you stretch this for 60 days, and all those consultations, tests that you may have to do, medications you have to undertake, so all of those can be claimed through this benefit under the policy. Emergency ambulance, it covers 1,000 rupees per claim. In case there is an emergency and you have to avail an ambulance, you can claim this much for each claim. Now, maternity benefit stays the same, 35 and 50,000 rupees for normal and C-section deliveries respectively. Newborn babies are covered from day one within the family sum insured, meaning if somebody has a baby tomorrow, that baby also gets added in the policy, or potentially you can get the baby in the policy within the same sum insured, and you can have any claims settled from the day one. But please remember, whenever you have a baby, you should take a bit of time and reach out to the HR, inform about this event, and then we'll get the baby added in the policy, so that in case there is any necessity for any kind of health insurance interventions, we can do this in a hassle-free way without facing any trouble. Pre and postnatal, we don't cover it. Copay, one thing that you should be knowing, many organizations, they apply a copay. Copay is a portion of the claim which is borne by employees themselves. For example, if an employee has a hospitalization and total claims comes about 100,000 rupees, total admissible claim comes about 100,000 rupees after deducting all the non-payable items, and if the copay is 10%, that means out of this 100,000 rupees, 10% will have to be borne by the employees and rest will be paid by the insurance company. But in our case, there is nothing like this, so it's good for us. So you don't have to share anything out of your pocket from the admissible claim amount. The entire amount will be paid for within the sum insured. Suppose you have a claim of 3 lakhs rupees, admissible claim amount 3 lakhs rupees, you will get the entire 3 lakhs rupees paid for. Daycare procedures, as you understand, this is a health insurance policy which typically is known as a policy which covers hospitalization of 24 hours or beyond. But there are many cases and instances whereby a treatment can be covered in less than 24 hours. But the catch is the admission has to happen. So it has to be a daycare procedure. So daycare procedure definition is that a patient has to be admitted in the hospital, and of course you'll get discharged from the hospital, so you'll get the discharge summary, but the duration will be less than 24 hours. That is why it's called daycare procedure. For example, say chemotherapy or hernia treatments, or say or say cataract surgery, all of these don't take possibly more than 24 hours. It gets done in less than 24 hours. And all those are termed as daycare procedures, and all of those will be covered under our policy. Waiting period, there is no such waiting period in your policy. All of us are covered in the policy from day one for any kind of illnesses or whatever that you may have had in the past. It doesn't matter. You are eligible to make a claim from day one. If there is anything wrong, any hospitalization is required, no questions will be asked whether it was there previously or not. Irrespective of that, it will be processed. Sorry. There are a few conditions which was there in the past also, now also it is there. Bioabsorbable stent and toric lens, multifocal lens, femoral laser surgery is covered at 50% of the total claim amount. So these are all advanced kind of treatments that we're talking about, still not established procedures, and the expenses vary dramatically across hospitals or doctors and stuff like this, and hence insurance companies typically put these conditions. LASIK surgery, it is covered only and only when you have an eye power which is more than plus minus 6.5. That's because LASIK surgery is a little sensitive surgery, and it is not advisable for anybody with a very little eye power or something like that. Just to avoid such confusions and complications it may have, this condition is put so that people only with a serious conditions with very high eye power, which becomes unbearable for people, they can go for this surgery, and that will be paid for. As I said, cashless is available across a large number of hospitals across the country. You can get this access on the mobile app, which all of you will have, or on the website. They're available. It keeps on changing, and hence you don't share a list because it's every day it keeps on changing. Reimbursement, of course, it is available, and you can make the claims through mobile applications, and many of you know, which we will explain in subsequent slides. Daycare procedures, sorry, these repetitions, we covered this. Now, this is something very important for us. OPD benefit, we had 1,000 rupees per family earlier, and now this has been increased to 4,000 rupees per family for everybody except the leadership team, whereby the limit is 7.5 thousand rupees per family. It covers all consultations, diagnostics, dental, and pharmacy also. Pharmacy is limited to 25% of this total OPD limit, which was also the case earlier. So the big change is here, 4,000 rupees OPD per family you can claim as a family put together, and for 7.5 for leadership it is 7.5 thousand rupees per family. Sorry. Health checkup, you also have a health checkup for the employees. The 22 parameters which will be covering under the health checkup benefit this year. You'll also get the e-consultation facility under this policy. You can get this e-consultation done through mobile applications. You can select and choose a doctor and schedule the call and have this consultation with the doctor for various I'm sorry. We also have Ayush treatment covered in the policy. Ayush is like Ayurvedic treatment, but remember this has to be on IPT basis, and it has to be in a government registered hospital, and the duration has to be minimum 24 hours. Okay. But this is a good benefit to have because nowadays there are a few cases, there are a few hospitals which are coming up where these treatments can be available. This policy also will cover psychiatric treatment, and this is also in addition to the policy because this is becoming a kind of a mainstream kind of issues people are facing, and we thought you should have it. So this can also be claimed for. Waiting periods, as I said, explained to you, is covered. So these are largely benefits of our policy. The changes, the existing continuity, the big changes, in fact, in two things. Sum and short, the room rent, gets ramped up big time from 2,000 rupees to 5,500 rupees to 4,500 rupees. It's a big change. And then you have OPD benefit, sum insured increasing, Ayush getting added, e-consultation you should have, health checkup you should have. So there's a lot of changes in the policy for us to have a better benefit in the policy. Now, how to access the policy? Many of you must be aware of it, but for the benefit of others and for us to rehash, you got to download the app and then you enter the policy number. This is the policy number that we have got this year, 933445117. And then you can have your employee ID that we have captured in the policy. In case there is any clarifications and issues, you can reach out to us, you can share that. And then of course you can have your mobile number and email ID registered automatically anyways. You'll receive the OTP on email or mobile number as you enter. And then you can have your password set. You can see the screen on the right side. This is how it looks like. And it's very easy and self-explanatory to use it. All of us know it. By now we use a lot of apps, so not much of any complications. So you can explore whatever that you can. You can explore the policy details, download the e-card. Sorry. You can intimate a claim, you can submit the claims and many more things. I said the e-consultation and all of those things also will be available on this app. You can use it. These are the some screenshots for you to have a look where and how things are, so that you're conversant before you go there. There's a network locator. As I said, the cashless hospitals are there on the web and on the applications. I think you should go and check, or at least when you go for the hospitalizations, you should have a quick checks, because there are cases whereby we see people, for some reasons, go to hospitals which is blacklisted, for example. There are many cases whereby a lot of frauds happen in these healthcare centers, and whenever it comes to the fore or notice of the insurance companies, they blacklist them definitely. It almost happens across the industry. All the insurance companies, they blacklist them because of fraudulent activities and stuff like this. So just to avoid such issues and complications and denial of claims, you should have a look at this before you get hospitalized somewhere or before you take any kind of medications or treatment. That's advisable for you. As I said, you can say all of these claim genie is a section where we can submit and intimate claims. It's very simple. It works well. Tried and tested for some time, quite some time in fact. Yes, there can be momentary lapse or error or whatever glitch, but it gets resolved quickly. Sorry. Claims, as you explained, you can track your claims, you can intimate your claims, you can submit your claims. Everything can be done on this. You can get the status updated here every time as you submit or respond to the queries and stuff like this. So it becomes handy once you submit a claim and get the update on it. So yeah, these are some of the screenshots for you to have a look at it. And there can be some queries, and the query reply also can be submitted on the app itself. There are detailed processes and documentations, explanations are given also on the website and the app, so that you are not having any issues or confusions. One thing that you should remember is make sure that the documents that you submit are in PDF format and legible and not very heavy in size, so that it can be submitted with no hassles or something like that. Now, when you submit the claim, so you can navigate like this as it is mentioned here. You can choose the personal claim, of course, and you can choose the claims type, inpatient treatment or OPD, whatever. You can always choose them. Select the group type also if it is available to you, or if you're aware. I'm sure that you are aware of. Date of admission, initial diagnosis, total amount of claim. So all of these you can fill in, and it will prompt you to do it one after another, and then upload those documents. You can view the documents if you submit, and then of course you can go ahead and submit it. Now, while you submit the claims, largely we should be aware of few things which is very important for us, so that we don't have any delays or queries coming in from the insurance companies. It's our job to ensure that we submit things in a proper way so that everything gets sorted in one shot. There is no to and fro, so that claims get processed quickly. Claim form, health card, all of these are there. The app itself, ID proof, you will have it. Cancel check or bank statement. Cancel check should have your name printed on it, not that you can write and sign, only sign. No name will not be accepted. So our cancel check will be accepted only when the name is printed on it. Okay. Discharge summary, final bill. A final bill in the sense it also should have the itemized bill. So there have been cases whereby the breakup of, say for example, there is a claim amount of say 30,000 rupees for medicine. Simply writing that medicine of 30,000 rupees will not work. The breakup of that medicines will be needed, and those are available, and hospitals do provide them. But sometimes, hospitals miss out, or something happens in a smaller hospital, they might not have all those details readily available. But ensure that you have all those itemized bills, because if you have seen any hospital bill, it runs into pages because it has small items and stuff like this. So those are necessary. We can't simply say the medicine bill is 30,000 rupees. It needs the descriptions and the items of all these 30,000 rupees. So ensure that we have it. And then payment receipts, we should have all the payment receipts. If you pay by cash, it has to be receipted. It has to be documented with a sign and stamp on the letterhead of the company's acknowledgement and receipt. Credit card and debit card slips also should be stored having with you, so that you can submit along with any other documents that you may have. But the card slip is also necessary. You should also have all investigation and test reports available at your end, which needs to be submitted. Prescriptions and doctor notes, of course, which is necessary because that is what determines the need of the hospitalization. And in case in any accidental claims, you have to also have either an FIR or a MLC, which is a medical legal certificate. So what happens in case of accidents? Typically, a lot of issues come up in terms of alcohol or drug abuse and something like that, which is not admissible under the insurance policy. So the government of India or across the globe is mandatory to ensure that you have this document ready to establish that there is no foul play, or there is no involvement of such things, which is why these are mandatory documents. And then there are a few cases whereby we see that particularly related to, say, infectious disease like fever or dengue, or say stomach infection, something like that. In such cases like this, the indoor case paper becomes necessary while hospitals skip it, but sometimes they don't give it. But in cases like this become mandatory because because the vitals of a patient becomes very important, like temperature, blood pressure, oxygen level, and stuff like this. All these become key factors for hospitalization, need of the hospitalization, and length of the stay in the hospital. So this also might be necessary, and hence you should be able to get this from the hospital to submit, and then you should be fine in terms of getting the claims processed on time. So this is largely the documentation that you should be keeping in mind, so that you can submit the claims well and properly. So that more or less summarizes the policy benefits in the process and the claims and the management. I'm so sorry. And then, as I said earlier, if you have any issues, any need, any help you need for any insurance related aspects, queries, or kuch bhi ho, anything, so you can reach out to us. So we have a dedicated guy for DesiCrew, which is Gaurav. I'm sure that most of you know it, and you know, and trust me, while he manages everything, I'm there behind the scene, keeping an eye on everything what's going on. So I'm aware of everything what goes on. It's not that he's the one who does it. Um, so there are people to look after everything. So in case you need to kind of escalate, and you can possibly reach out to ma'am, and ma'am can obviously share my number, or not to everybody, but yeah, whenever you need it, you can reach out to me. I'm accessible all the time, just like my team is available. I'll also be available, possibly more than the team. So no issues. We assure you that we'll be there by your side, because that's our job. We consider ourselves as part of you only. We work for you, and hence it's our job, our duty, responsibility to help you and to ensure that you get the best in terms of the claims, issues being resolved, any queries that you may have, and we'll be absolutely happy to help you. That concludes my presentation on the health insurance. And then possibly now, in terms of claims, I think ma'am mentioned briefly. I think last 4 years, except 1 year, I think all the 3 years we have made claims which is either as much as the premium, or in some cases it is crossed also. But despite that, we have had a very healthy relationship. Yes, we have had few cases, maybe for some confusion, something like that, which is there. But the only thing that I can guarantee you that you will not find us lacking in terms of helping or making efforts to resolve issues. That is our promise. That's my promise to you guys. So claims, of course, is a very important parameter in terms of how a policy runs smoothly or not. Organizations looks at various things. For example, the insurance company increases the premium drastically because there's so much of claims and something like that, which happens everywhere by all the insurance companies. We try to manage it, and they are balancing them. But as ma'am rightly said, the more benefits we added, the chances of having more claims will be there, of course. So it will put pressure. So for us, we all are there for you to ensure that all cases, all help that you need, we do it. But as I said, it's a tightrope that we walk, so that we can balance both, our employees' well-being, and of course the organization also has to look at the outflow or the expenses and something like that. So we try and do whatever that we can. I'm sure ma'am knows it. So yeah, that's how it is. Over to you, ma'am. Then we can possibly take some queries if people have it. Then
Yeah, thanks, Gita. I'm sure there are some queries because we have a good number of people here who joined here to listen to you today. Uh, I just want to tell my team, any queries regarding your previous claims, anything that you want to know, how you can, uh, or what are the things that you need to do in case you want to go to a hospital, hospitalization and things like that. Any queries you have, I think Sudipta is the best person to answer that for us right now.
yeah. So ma'am, in terms of, suppose there is a claims which are there needs to be resolved, we'll note it down, and we'll have a discussions one with the employees separately, maybe on Monday itself. And then we'll take the queries which is related to our policy terms, benefit, everything, and that
Sure.
will be better.
Yeah.
But yes, claims related issues also, I'll note it down and ensure that we'll have a discussions one-on-one on Monday itself.
Yeah, Sudeep, I have a quick question. As you were talking about the app, I just opened the app and checked the policy, and it says expired on November 2024. So have we renewed
Yeah.
it?
You have to add the policy. Yeah. So actually, the policy number changes every year. I'm so sorry, I'm having a little bit of trouble. So the policy number changes every year. So you have to add the policy number. New policy number that I share on the screen, which you can possibly circulate among all the employees. Ma'am will possibly ensure that someone sends it out to all of us. And then you have to add that policy. and that will be showing as the active policy. The previous policy expired, of course, as you understand. One policy number is valid for 1 year, and this policy number is valid for another year, from 28th to 27th of November next year.
Yeah.
Okay.
Vinod, we have received the details from Sudipta yesterday evening.
The
So-
e-cards are there, so if you need it, suppose things are not working, you can reach out to us. You can send you the e-card also.
Got it. So you're saying we'll get a mail from HR with the policy number, then you have
Yes,
to add
yes.
it on the app. Okay. Fine.
Yes, and
The two
Pankaj
things-
just got the
You should,
details today.
you should remember two things: the policy number that ma'am will share with you, and of course, I think you'll be asked to enter the employee ID also. Okay.
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 That it will validate you are the right person. Okay, you're not impersonating somebody else. That's a little
Okay. Got it.
Yeah.
Hi, sir. This is Rajan here. Hi.
Yeah. Hi. How are you?
Fine. Thanks. Sudhita, I entered with a new policy number, which you have given the presentation.
Yeah.
But it is not matching with the records, is what it says. After entering my employee ID, it got asking for the email ID and the mobile number.
Asking for the employee and the mobile number.
Employee ID, email ID, and the mobile number.
Okay.
So it says that it is not matching with the records.
Fair point. I think another thing that I missed to mention. What happens? You were there part of the last policy also, right? Yeah. So I think we'll have to update the employee and the mobile number at our end from once in for all the employees, so that it is done at the back end and employee can easily access. We'll do that. I'll take this up with Veena ma'am and the team.
Sure. Because as we all the members start filling up the data in the app, they may face this problem. Actually.
Yeah, I agree. So what I'll do is I'll take the mobile number and the email ID for all the employees and update this from the back end.
Sure.
We actually a couple of days back got a policy issue. There's a bit of changes in the data and stuff like this. It took a little time, but we'll resolve it. Don't worry. Yeah.
All right. Sure. Thanks. I just have one more query. After that, I'll leave it to others to ask their questions. The LASIK surgery that you mentioned, which is at plus or minus 6.5.
Yeah.
There are cases, at least for my son, who's at 3.5. So
my daughter also has 3.5.
Yeah, which is cylindrical. So there also it was diagnosed with LASIK surgery after a certain point in time. So in that case, how does it happen? It doesn't happen at all. It is not covered.
Yeah, it will not cover. See, it's something that I explained to you that why. See, this again, there can be debate on this 6.5. It can be say 5.5. Somebody can say, but somehow I have seen either 6.5 or 7.5. Okay, so less than that, insurance companies are a little apprehensive about offering this benefit.
Oh, okay, all right. So it is part of the insurance companies.
Yes. All the companies that are there in the market, if somebody has 7.5 or somebody that's the lowest. 6.5 is the lowest.
6.5 is the lowest. All right, all right, sure. Thanks.
Hi, so can you explain the OPD in detail? OPD of your person that you are.
OPD is like, okay, explain. It's a good question. So what happens? I think you guys are lucky to have this policy for you. Not many people have it in the country, honestly. We handle many policies. So OPD is something like this. For example, somebody has fever, high fever, something like that. And you go to a doctor, consult him, he charges 1,000 rupees, ask you to do few tests or something like that. All of these will not be covered under health insurance policy, typical health insurance policy, because this is not a hospitalization case. So all these expenses that will cover, you're incurring, that will get paid for by this OPD benefit. Okay. Could I explain to you?
So that's the max would be 4K, right?
Sorry. Yes.
So that is per month, one visit. How many visits are allowed? You have any limit set?
No. 4,000 rupees is the limit. Only limit.
That's per year.
Yes.
Okay. 4,000 per year. Okay.
Per family. Okay. So all of you put together claim 4,000 rupees per year, which was 1,000 rupees earlier.
Okay.
While it may sound a little low for us as an employee, but trust me, this is almost like a cash benefit to the employees. Okay,
Correct.
large, as you understand. So, if you see, 7.5 and 4,000 rupees multiplied by X number of employees, that becomes automatic premium for such benefit. All right, that's why this is kept a little low. And in our country, you know how things are. Cashless OPD is not there, and people have no standard to follow or something like that. Healthcare practitioners, they take advantage of many situations. There is no process vis-a-vis a developed country whereby things are a lot more standardized. Not that somebody can charge whatever they want or something like that, and less leakage happens. So because of that, it's very expensive to have OPD benefit at the policy to a higher limit. But 4,000 rupees, trust me, because we deal with hundreds of policies, it's a very good benefit. Most of all the policies don't have it, and 4,000 rupees is a very good benefit for all of us.
So this covers even the medicines that the doctor is prescribing, right?
See, look, yes, of course. So in case of hospitalization, of course, you should try to ensure that you get pre and post benefit and don't use this OPD benefit. After that, after if it is exhausted or it's a normal thing, suppose you have a fever or something, like stomach ache, you go to a skin infections, go to a doctor, consult him, come back and get fine. You use this benefit for such issues. Okay.
That's what I'm saying. For example, if I go for fever, doctor is prescribing 500 rupees for
Yes,
medicine.
yes.
So his consultation charges is 500, a medicine 500, so total will be 1,000, right?
Yes, it will be paid for.
Yeah.
So ensure that you have the prescriptions in place. Without prescriptions, it will not be paid for. And also the bill, you should ask for the bill. Sometimes the doctor, they write 500 rupees on the prescriptions. Don't you should ask for a bill. Okay?
Yeah, got it. Thank you.
Yeah.
Yeah, this is Shanmugam here. Hello.
Yes.
So, your presentation, you was mentioned the health checkup, 22 parameters covered. So, can you list out what is the 22 parameters?
Yeah, so we have the list. I can't remember though, but I'll share that with ma'am and it can be circulated among you. It is typically kidney function test, liver function test, and a few others which will have available in that list.
Yeah, if you have, please share it with us. Yeah.
Yes, it is there. It is there. Of course, it is there. So we'll share that.
And my another question: so, do you have any age criteria for the cataract surgery?
No. So the policy has a 80 years age band for the parents up to age of 80 years. Between that, there is nothing. There is no age criteria. The policy covers parents up till age 80.
80. Okay.
Yeah, but in case suppose somebody is already 80, suppose someone's dad is 80 years of age, already in the policy, next year we renew it, so he will become 81, so we'll consider that to have it in the policy continuing. But a fresh employee with say 82 years of parents will not be added in the policy.
If he or she is an existing customer, just we can extend.
Yes.
Got it. Yeah, thanks.
Sorry to add up the final question. Do you have any contact number as such, 24/7 helpline number where we can, in case we have queries to contact? Because you are giving us an email ID. Is there any way there is a number which is available 24/7 where we can just call up and in case there is any query we can ask?
Yeah, so I think you can have Gaurav's number. We'll share that number through ma'am.
Okay.
I think the another thing that you should look. As I said, we are there to help you at any point of time. But few things that we should also be keeping in mind. So again, it might be counterintuitive, but let me explain to you how it works. So you will need help in terms of say cashless, largely, right? Beyond say 7, 8, 9 p.m. or something like that. All right. But for cashless to happen, all the TPA desks shut. You know what is the TPA desk? It's a third-party administrative desk, which hospital is their own employees who manage the cashless requests or something like that. So they shut by say maximum by about 7 p.m. in the at night in the evening, and insurance companies also, they also have this deployment of the people very less at night, because cashless don't happen during the say after 7, after 8. If it is not a discharge, fresh cashless is not initiated after 7 or 8 p.m. It only happens next day morning. Okay. So as such, for cashless, you don't have to kind of be so worried saying, I have to call at in the middle of the night. See, I'm not saying that you don't call me. You can call me. You can reach out to me. No issues. All that I'm trying to tell you is that even if you call, say, someone for cashless, it won't happen during the night. It will only happen next day morning. But you don't have to be worried on that. Your cashless, suppose you have got hospitalized this evening, say late in the evening, say about say 9 p.m. All right. So your cashless will happen next day morning, and you don't have to be worried about anything, whether it will happen or not. It will happen. If it is happening in the evening, it will happen tomorrow morning also, right? So I think this, all of you should be, is again, I'm trying to make you assured that you'll have no issues. Your cashless will be taken care of on priority, and it will be done very quickly, as it is done most of the cases. So that's just a request or just a assurance from our side. You don't have to panic, or you don't have to kind of see, what is happening. Cashless is not happening. It's not happening because the TPA disk is not functioning. They cannot send the request to the insurance company. And of course, if the request doesn't come, that will not come. It will only come the next day morning. All right.
Yeah.
But that's the clarification. Otherwise, if you want to reach out to us, you can reach out to us at any point of time.
Yeah. Thank you.
Next, any question anymore?
Hi, this is Shan here.
Yes.
And I would like to know, is there any disease which is not covered, which cannot be covered? Like,
That's a good question. That's a good question. Actually, I should have had that the exclusion wala hissa, but let me attempt to tell you. There are cases like, say, STDs, sexually transmitted disease, suicide attempt. For example, there was a case. I don't know, was it with us only? I think there was with us only, no, somebody else. So someone had an issue with his spouse or something like that, and he slit his arm so badly. It was, I wasn't able to look at that. It was so bad, gruesome. And he ended up spending a lot of money, honestly, for that. I said 2-3 cuts were there like this. And my heart was aching that the claim was rejected. It was such a bad scenario. Look at that plight of that boy. He had an issue, and then he cut his arm, and then he had to go through the treatment. He had to spend the money, and then he doesn't get the claims approved. Okay, so suicide-related stuff, STDs, and then alcohol, drug abuse, puberty-related issues, say cosmetic treatment. You possibly can sense which are the things that I'm hinting. Largely they're self-explanatory, and such ailments are actually not covered. Okay, so let me try if I can pull up the list of exclusion. Just wait, hold on. I'll just quickly do that. Okay. I'll just try to share this in the screen. Okay, here we go. So it might be from somewhere else, but nevertheless, it will help. Okay, so let me share the screen. Okay, it will be from some other documents of mine. Let me share the screen. Share the screen. Okay. So can you see the screen, sir? Is it visible?
Yes.
Yeah. So don't go by. These are some of the things that we'll explain to you, and
Okay.
these are all almost uniform across insurance companies, across clients companies. Okay. These are all permanent kind of exclusions. All right. So as you can see,
Okay. Here you mentioned psychiatric treatment.
yeah. So
As
yeah.
yeah.
These are, see again, psychiatric services coverage that I have mentioned, so which is specifically mentioned in the policy, that gets covered. But normally these are exclusions, permanent exclusions. Okay.
Oh,
But this,
okay. Okay.
but this is covered in our policy, psychiatric treatment. As I said,
Okay.
I
That's
picked up
all.
the document from somewhere else. It's not for this. So this will get deleted from here. Okay, for our
Sure.
case.
Thanks.
Largely,
Thank
these are
you. Thank
kind of the things which is not covered. For example, experimental treatments. So, there's some inventions coming up with something and tries to
you.
test say case or not. Those will not be covered, right? And say
Okay.
developmental problems. For example, a child is born and a few organs are not developing correctly, properly.
Mm.
Such things also will not get covered. Reproductive treatment, so for example, IVF, infertility related treatment, all those will not be covered. All right.
Okay. Okay.
Homeopathy treatment, suppose you want to go for an OPD for homeopathy, it will not get covered. Okay, only for
Mm-hmm.
allopathy for OPD. External congenital conditions. So, for example, someone has a cleft lips, right? You understand how it is. So, suppose someone want to go for a cosmetic surgery and fill it up, or patch it up. All such things will not get covered. Unlawful activities not covered. HIV/AIDS will not get covered. All right.
Mm.
Circumcision is not covered until and unless it becomes medically necessary. All right.
Okay.
So
Okay.
treatments like this will not get covered. Mostly, you understand what it is largely talking about, right?
Yes. Yes.
Yeah.
Sure. Thank you.
But there's something called speech disorder mentioned, right? There are adults who face from stammering, so they might go for treatment for stammering, right? So are you not covering that? Does it come under speech disorder? Stammer
Sleep,
problem?
speech disorder. Speech disorder, you were saying?
Yes, yes, yes.
Yeah, it comes into that only. Yes.
Okay, so it is not covered.
Yeah. I think many people haven't joined today, isn't it, ma'am?
Yeah, actually, not many have joined today.
So I think we should do it again, maybe.
Yeah, we will have the similar session again sometime mid-Jan. Once
Yeah.
everybody has the policy numbers and they have
Yes.
logged in and if they have any issues and all that.
Yes.
So
Yes.
then
Yes.
I think we'll have one more session. We'll do it on DC Live then.
Yeah.
So that
Sure.
we can
Sure.
have more people join in and all of that. So,
Yes. Yes. That will help.
any more queries, any questions you guys have? Any challenges that you faced during any of the previous claims that you did?
Yeah. So you can highlight that to me also, so that But anyways, will be available, so you can write an email to us and explain that, and of course, we'll respond and resolve. And if anybody has any queries, also can reach out to us. Of course, I get a lot of calls, by the way, so so that's okay. I'm always happy to talk to all of you. Not that we get to talk to more often, but it's okay. You can reach out to me as well.
So Do we have any other questions? Anything that has to be answered?
I think it's done because not many people are there. 21 members are there.
Yeah.
That-
Sudhita, I think we can get over this call right now, and we
It's
will
okay.
have a
I'm okay.
separate-
I can still wait here. I'm absolutely fine to be here.
Okay, because we have another call at 5,
Okay.
which is our monthly call, which happens twice a month.
We should
So
have,
we're going
we
to
should have
for
some
that
meeting
one.
time for them. Yeah.
So,
Therefore, that's all right.
so I think we will connect again sometime
Yes,
mid-Jan.
of course.
And you guys, in case you have to reach out to somebody from Care Health, you can reach out to Gaurav. And the escalation point will be Sudipta.
Yes.
Okay. Thank you very much, Sudipta, for your time today, and thank you all the participants who've come here. I hope your queries are answered, and if not, we're going to have one more session mid-Jan. We'll do it on BC Live, and if you have any queries, any questions which you want to ask, which you couldn't ask today, you can write to me. We can get it answered by Sudipta through emails as well.
Yeah. No, I think they have been really nice questions being asked. Good. So you got to challenge me. Sometimes it's good that I don't have answers. Sometimes.
Thank you, Sudhita.
Thank you, Sudipta.
Thank you, Sudhita. Appreciate it. Have a good evening. Bye-bye.
Yeah, take care.
Thank you. Bye.